My name is Dr. Gertie Chimeka Anyanwoke. I am an infectious disease specialist and I practice in Baton Rouge and Gonzales, Louisiana. In this video, we will discuss the management of hospitalized patients with coronavirus disease 2019, also known as COVID-19. The evaluation of hospitalized patients with documented or suspected COVID-19 should assess for features associated with severe illness and identify organ dysfunction or other comorbidities that could complicate potential therapy. Patients hospitalized with COVID-19 should receive pharmacologic prophylaxis for venous thromboembolism, as COVID-19 has been associated with thromboembolic complications. At this time, there are minimal data informing the risks of non-steroidal anti-inflammatory drugs, also known as NSAIDs, in the setting of COVID-19. We suggest acetaminophen as the preferred antipyretic agent if possible. If NSAIDs are needed, we use the lowest effective dose. We do not discontinue NSAIDs in patients who are on them chronically for other conditions if there are no other reasons to stop them. Also, specific concern for COVID-19 should not impact the decision to start or stop angiotensin-converting enzyme ACE inhibitors or angiotensin receptor blockers ARBs. People who are on an ACE inhibitor or ARB for another indication should not stop their medication. We make a point of continuing statins in hospitalized patients with COVID-19 who are already taking them. Our approach to COVID-19 specific therapy in hospitalized patients depends on the severity of disease. Severe disease is characterized by hypoxia, which is oxygen saturation equal or less than 94% on room air, or need for oxygenation or ventilatory support. For patients with non-severe disease, care is primarily supportive with close monitoring for disease progression. When clinical trials for treatment of non-severe disease are available, we prioritize those who have laboratory features associated with disease progression. For hospitalized patients with severe disease, we recommend remdesivir if available. We try to initiate remdesivir early in the course of severe disease. For example, when patients are receiving supplemental oxygen but are not yet intubated, as the evidence for benefit is clearest in this group. In the United States, remdesivir may be available through a U.S. Food and Drug Administration FDA emergency use authorization. We also refer patients who are able to get remdesivir to clinical trials for other agents, if they allow current use of remdesivir also, as at this time. An alternative for additional therapy outside a clinical trial is investigational use of convalescent plasma, which may be obtained in the United States through an expanded access program as at this time. For hospitalized patients with severe disease who cannot get remdesivir through emergency use authorization, we recommend referral to a clinical trial. We also favor referral to trials that include remdesivir in combination with other therapies. Other investigational therapies include convalescent plasma, hydroxychloroquine, interleukin IL-6 pathway inhibitors, and other immunomodulatory agents. If neither a clinical trial nor remdesivir through emergency use authorization is available, clinicians may be able to obtain convalescent plasma for investigational use in patients with severe disease. In the United States, as at this time, this can be requested through the FDA's Expanded Access Program. When none of these options is available, we favor supportive care. In particular, we suggest not routinely using hydroxychloroquine or chloroquine outside the context of a clinical trial, given the lack of clear benefit from limited data and potential for toxicity. We also suggest not using lopinavir-ritonavir, also known as Kaletra, for COVID-19 therapy outside of a clinical trial. Patients with severe disease often need oxygenation support. Some patients may develop acute respiratory distress syndrome, ARDS, and warrant intubation with mechanical ventilation. This will be discussed in details by one of my other colleagues. Infection control is an essential component of management of patients with suspected or documented COVID-19. Again, this is discussed by another colleague of mine. Thank you for listening. A lot of this information was called from Up to Date. You can find my other videos on my YouTube channel at Wellness Care Incorporated. Again, my name is Dr. Gertie Chimeka Anyanwoke. I am an infectious disease expert and I practice in Baton Rouge and Gonzales, Louisiana. Thank you and stay safe.